Wow, so this is a real challenge now to try and sum up 2 days of meeting and many hours of presentation and discussions and questions in a few minutes. A really very difficult challenge, but one that I'm delighted to have been asked to take on. I mean, first of all, I just want to thank everyone who's listening, the attendees who've joined this meeting. And of course, the whole point of this meeting is to allow parents, family members from around the world to join the meeting and to hear from neuroblastoma doctors, from others who care for neuroblastoma, to ask your questions. And we're delighted that overall we've been joined by more than 500 participants from 45 countries around the world, which is pretty remarkable, and I think is really a testament to how important this meeting is. Of course, I'd like to thank all of the speakers. I think the charities behind this who have organized this meeting and put so much work into it have really done a phenomenal job in continuing to attract really, some of the world-leading experts in neuroblastoma, so that you can hear directly from the people involved in the studies that we hear about, directly involved in developing these new therapies. And really, I think, to me, one of the things that's amazing about this meeting, either in person or in this virtual form, is the opportunity to hear from the world-leading experts, and actually something that we as physicians attending this meeting actually get out of it as well, is the opportunity to hear from our expert colleagues. The platform that we've been using for this meeting has been, I think, really excellent and has made the meeting run incredibly smoothly. So I'd like to thank GRC World Forums on behalf of all of the organizers for providing that platform and for their technical expertise. And of course, behind the scenes, also to thank the other supporters of the meeting, especially Y-mAbs Therapeutics for their support in putting this together. I've been asked to advertise the survey one more time. I promise this will be the final time we mention it, but it really is important, please, if you have the opportunity to fill in that survey, which you can find on the left-hand menu on the screen under feedback survey, because we really want to make sure that these meetings cover the topics that you're interested in, that the format is as helpful as possible, and we do take into account the feedback from 1 year in planning what happens in the following year. And as you've already heard, the sessions from yesterday's meeting are already available on demand on the platform and will remain there. I'm not sure exactly for how long, but certainly for a good while, and they'll certainly be archived and available in the future. And the sessions from today may not be up there yet, but will be up by tomorrow. So if you've missed any sessions or you want to recap, then there is an opportunity to do that there. So, what have we learned? What have we talked about over the last couple of days? We've talked about an overview of neuroblastoma. I think we've heard how complex a condition this is and how scientifically interesting and challenging it is, but how really that translates into a huge complexity when we decide how to try and tackle this disease. We've heard about the latest approaches for relapse and refractory disease, and we've heard today about maintenance therapies, about the role of high-dose chemotherapy, and a discussion about the advances in immunotherapy for relapse and refractory disease. And then, of course, importantly, we've discussed most recently late effects, and of course just had that kind of incredible session with two neuroblastoma long-term survivors to really hear about the long-term patient perspective. And of course, ultimately, that's what all of this is about, and ultimately that's what, as clinicians, we're striving to do. We're not ultimately doing this for scientific interest. Ultimately, we're doing this because we want to try and cure children, get them through this disease, and allow them to go on and live long and fulfilled lives. It's really hard, I think, to draw out specific themes from what we've heard. And I would say there's an incredible amount of detail there. And I hope that you've been able to pick out the details that are most relevant to the things that you're interested in. I hope you've got some sense of the huge amount of work that's going on around the world to tackle the disease. And I think this is one of the remarkable things about neuroblastoma. It's a rare cancer overall, but it really does have an incredibly strong scientific clinical community behind that, working together to move the field forward. And beyond that, I think a sense of partnership, and I think this meeting really helps to bring that out, that partnership between clinicians and scientists and families, parents, advocates, patients, that ultimately we're all working together to try and tackle this disease. And I think allied to that, then, a sense of community of all of us working together towards that common goal. And I was struck by something that was also said in yesterday's talk, that ultimately what sustains all of us, I think certainly parents and families, but actually also us as clinicians looking after these patients, is hope. And I was struck by the words from Laura Katie Weberling's talk yesterday. Hope lifts us up and propels us forward. Hope can be brought to us by acts of kindness and care. And I think, those words are really important. A lot of this is incredibly difficult, and I won't pretend to know what it's like to go through this as a parent of a child with neuroblastoma. But I think, and I hope, that the sense of hope that we put forward by knowing that there's a large group of us working together to try and make things better, I hope that hope does lift us up and propel us forward. So thank you again to everyone around the world for joining. I know it's very late in certain parts of the world. Please do fill in the feedback survey. Join us again next time. And finally, I just want now to introduce this video of children who've been affected by neuroblastoma and supported by the charities that have arranged this meeting. Thanks very much.